about today is some dynamics with the knee for extension and flexion, just to think about how there's an accompanied movement of rotation, both when you flex, the relative to your upper body, your lower leg is going to turn in, so internal rotation. So you see my toes there, when I flex, they're going to turn in if they're not grounded. But the thing is, usually when we're using our legs, they are grounded. So what you're going to notice is that your hip is going to turn out, and therefore you're going to be swinging your knee out slightly as you say flex into a lunge or a squat kind of motion, or there's a portion of walking that will be similar. So when we extend, however, when we extend out, or here, if I slide out that way, right? So then the femur here, the hip and femur are going to turn relatively internal, and the planted tibia and fibula are going to stay more out. But again, if you're planted, it's not going to move. You're going to be moving more from here. But if I am your therapist or someone working with you, I'm moving your leg that's open or open chain, not planted on the ground. I'm more likely to be moving the distal portion here. So just understanding the difference of when you flex, the hip goes out, that relatively the lower leg is turning in, and that's rotation is really crucial and important. So if you're looking at your patella, to go along with that, so you can do this with movement, with like a heel slide. Right now I've got my foot up on a stool, say, and so I can bring it closer to me. I can, when I bend, I can kind of guide, and I'm gonna kind of pull here. If I'm sliding back, I can pull and kind of guide here, and I can kind of stretch, maybe work some of the tissues, the fascia. This of course will work better without any clothing on, just the bare skin, so you can kind of grip it, massage it, guide the patella is going to follow the tibia relatively, at least the tension inside and more down that way, right? While the femur is going to be rotating out. And if I straighten the patella, get my foot out of the way here, the hip is turning in, the lower leg is turning out, and so the patella also is going to turn out, but it's going to be, because my quads are firing here, I'm going to be pulling the patella this way towards me. So I can combine those, kind of flex in, pulling in here, or maybe pushing out there, and kind of guiding here, or stretching there with that. And again, not too aggressive, just to stretch and kind of mobilize there. And then when I go in, I can turn at the hip, and then turn out, maybe the foot, ankle, a little bit to tension against that. And then I'm going to also be pulling the patella towards me and out and massaging. Okay, and you can do this laying down. It's easier to grab and hold when you're setting up. You can maybe do it standing if you're balanced enough to get in there, but then when you're walking, speaking of standing, you want to be able to kind of feel that kind of flex as you pull back here. The thigh, the femur is moving with the hip out, and a planted foot is going to stay in, and that's when that patella is going to, as you bend the knee, or able to bend the knee, it's going to stay down and in a little bit, or tension down and in. And when you stand up, everything comes more to neutral, so relatively the hip is turning in, and then the tib fib is staying more out, and that patella is going to come up and out this way a little bit. And then when it's behind you, everything's turned in even further. Same dynamic, just a little further along, which is really tough to reach there. But just try to be mindful as you practice these things. Help guide. Say you had your knee replaced, everything's really tight, stiff, or some kind of knee surgery, or just in general it's tight and stiff. But you just want to have a sense of how that should flow, so you can bring your attention and start to guide things a little bit better.